Hi, Mitch Haushold, Maximum Training Solutions. So I want to go through a specific application for taping for drop foot. And basically what we're going to do is we're going to use tape to help us create an AFO. But it's better than an AFO. It's simple, it's cheap. You can teach somebody how to do it themselves. It also fits in a shoe really, really well. It's super comfortable. I started playing with this a few months ago because in a lot of the courses that I teach, I get a lot of questions about treating people with neuropathy, foot drop, stroke patients, those types of people. And for full disclosure, this is not my typical taping or my patient population, but I do personally get some drop foot when I get really fatigued because I battle multiple sclerosis myself. So there's a personal component to this as well. But there's a couple different ways you can do this. It depends on what the patient's symptoms are. Most people that have some foot drop issues, they'll actually go to plantar flexion and inversion, where they drop that third, fourth, and fifth toe more than the first. So for that person, you're going to want to anchor the tape here on the lateral side of the foot and circle around this side, and that's going to help them pull this toe up. If they drop that first toe, then we can go the other direction, basically wrap it around that way. But we're going to use a tab taping technique with it because we want to put some stretch on the tape. Remember, we never ever put stretch on tape unless we use a tab, because the tab will protect the skin, also give us a lot of control over a specific area. So to make the tab, we're going to tear the tape in the middle, the paper in the middle, and then we're going to fold it on itself. So just like that. So we're creating this tab that looks something like this. Then what I want to do is I'm going to back her off so she goes into plantar flexion here, and I'm going to put my tab right over the front of the ankle, or maybe just a little bit below it, so kind of right over that talar dome area. Just lay it on there like that. Make sure it's stuck down really, really well. Now I have really good control over this area. So then what I'm going to do is I'm going to take my piece of tape and I'm going to anchor it down here on that lower leg, down onto the foot, and then peel my paper back, and I don't want to put any stretch on the tape here until I grab that anchor. Now I'm sticking it down really well because I want to make sure this stays on well. Then what I'm going to do is I'm going to take my right hand and I'm going to apply maximum stretch to this tape. So I'm just going to expose about this much of the glue, and then my left thumb I'm putting right on my tab. That's a couple different reasons for that. Number one is I want to make sure the tab stays on when I pull the tape, but also I'm putting it right over that talar dome, and I'm going to have her come into dorsiflexion here in a second. And as she does that, I'm basically pushing back on that talar dome to get it sitting back in the joint where I want it to. So I'm putting that pressure on that talar dome. Now she's going to come forward into max dorsiflexion, and then as she does that, I'm going to take maximum stretch on this tape and then lay it on, try to avoid as many wrinkles as I can. And then after that, I'm just laying this tape on, so I basically have a big anchor as I go around the ankle. So now as she backs off, you can see here, stuck down, it does appear as though it's coming up, but this is basically where this the tab is that's protecting the skin. But as now she goes and walks around, this foot, she's getting both a neurosensory input as well as a mechanical effect because I put stretch on the tape in order to help her with that ankle dorsiflexion, get rid of that foot drop. So just another great taping technique for your special patients. Give it a try. Let me know how you feel.